expansion in Utah. Under SB 96, the bill that modified Proposition 3, the state was asking the federal government to pay 90% of the cost for expanding Medicaid to 100% of Utahns at or below the federal poverty level. HHS informed the state that that waiver would be denied. That means the feds will continue paying 70% for the time being. SB 96 does have a fallback to expand to 138% of the FPL and a 90-10 split, but that doesn't happen until next year. We're digging deeper into the issue with Representative Jim Dunnigan, the House sponsor of SB 96, and Matt Sloniker with Utah Health Policy Project, a local advocacy group. Gentlemen, so glad to have you on the show. Thanks so much for being here. Appreciate it.
Good morning.
Representative Dunnigan, let's start with you. Now that the waiver, you've been told it would not be approved by HHS, what's next?
Well, let me just first say, where does that leave people that are currently in Medicaid expansion? And we're talking about adults. Children are already eligible, so we're only talking low-income adults, and nothing changes for them. Those that are signed up, we have about 34,000 Utahns that are on Medicaid expansion since April 1. Nothing changes, and the doors are open. There's no caps, there's no work requirements for this year. Just come on and get coverage. So the most important thing we could probably do today is tell people that nothing has changed.
That's a good point, and I did want to get into that. So let's go ahead and keep on that now before we get into what's next. Matt, let's bring you in. What are you guys doing working with people that come to you and have these questions?
Absolutely. So Utah Health Policy Project, the organization that I work for, has an outreach and enrollment program that actually helps people enroll in health insurance, whether it's Affordable Care Act insurance, Medicaid, or CHIP. And what we've been doing is getting out there into the public, making sure that people understand that Medicaid expansion is an opportunity. And yeah, it has been confusing. You know, what happened during session? What happened last November? Do we have Medicaid expansion? Do we not have Medicaid expansion? With this latest news, we're worried again that the public may be a bit confused. But to clarify, I'm 100% behind what Representative Dunnigan is saying. We need to get the word out that you can enroll in Medicaid expansion. We've frankly been a little dissatisfied with how many people have enrolled, and we want to get out there and make sure folks really understand that they can reach out to us as an agency and to Medicaid and DWS and get enrolled.
I've been a little surprised by the enrollment numbers too. They've been lower than what I thought they would be. That program, if I remember right, became eligible April 1st. Your thoughts on why not as many people as we might have thought are enrolling?
Well, there's a couple of reasons at least. One is we have a great economy. I mean, if we were going into an economic downturn, I expect we'd have a lot more people enrolled. So a lot of people can get coverage through their employers, but there are many that cannot. And we thought it would be a ramp up. It's slower than we thought, but with so much of the debate going on within our state and nationally, I think people were perhaps confused, which is why that's the message I want to carry today is if you are eligible and you want it, go sign up for it.
Okay. Any thoughts on why the numbers are lower than what we thought?
I think Representative Dunnigan's, what he's onto there is probably true. I think the confusion that came out of session is in part the reason. I think the numbers may have been a bit inflated too over the years. We might have been estimating too much. But I think in open enrollment in November, when people are used to signing up for health insurance, we'll see a much bigger ramp up. So I'm not sure where they'll end up, but yeah, they have been a little slow.
Okay, any final thoughts on that before we move on to the next?
No, just we're open for business.
Okay, so you guys are very agreeable on that part.
We agree on everything.
Yeah.
Absolutely.
Let's get into the part that maybe you don't agree on so much. What's next?
All right, so we had our attorneys evaluate that over the weekend, and this is what they said. You passed a law during the session, Senate Bill 96. It lays out 4 steps or 4 phases, and that's a law. You have to follow that. So we're in phase 1 now, where we're open for business. Phase 2 is to submit the per capita cap waiver to the federal government, which they indicated last weekend that they're not going to approve. We still have to submit it. That was submitted yesterday, in fact. So that waiver was submitted to the federal government yesterday, and we'll see what they say formally. They told us informally they're not going to approve it, but what they told us is they're not going to approve the per capita cap. There are still several other waiver pieces of flexibility that we want to see what they say.
Okay, so your point is it's the law, we have to follow it. You guys say, let's get on with this.
Well, I've got an opportunity to present here. I think we can follow the law as well as go ahead and implement full expansion and stay within the letter of the law. There's nothing that I read in SB 96 that precludes the state from filing a state plan amendment, which is the simple process that's provided for in the Affordable Care Act to get Medicaid expansion go ahead and do that, and then pursue some of these other waiver requirements kind of on a sort of parallel basis. That strategy was used in Virginia. It seemed to work very well there. And we wouldn't have to wait. We wouldn't have to spend 30 cents instead of 10 cents on the dollar in order to get this program, continue this program. And I think it's just wise. We wouldn't also have to continue freezing people out. Again, I mentioned a little earlier that we help people with enrolling in health insurance. Well, we've seen too many people who either one, found that the premiums and the cost sharing in the ACA were just too hard to make work for their families. We've also seen folks that have a health condition, they can't get into Medicaid because they make too much, but they also can't get ACA because open enrollment hasn't been open since April. So why not just do it now? Let's file that state plan amendment, get things done, and I think we'd be in good shape. We can still apply for the waiver.
Let's send that question right to you.
So we have the law that we've got to follow, whether we want to or not, and that says the next step is to start working on phase 3, which does expand it to 138% of poverty. And so we intend to start working on that. It has some other waivers in it, but that's the next step. And we're going to follow the law. We're going to do that.
So do you see any window that Matt brings up here where you can put in
it doesn't make sense to say we're going to do the state plan amendment and expand all the way to 138 and then submit a waiver to go to 138 with some waiver conditions on it. There's no point in doing that. We have to do phase 3. We have to do phase 4 and those steps unless the law is changed. And we do intend to get going on phase 3 right away. We're not going to wait and until we get the formal disapproval or denial. We're going to get going on phase 3, which expands it to 138% of poverty.
And when would that happen under the law?
Well, it has to happen by mid-March. That's the way. It could happen earlier, yes. Okay. And we've talked. I met with the governor and others Monday, and we intend to get going on that.
Okay, Matt, that is the law as representative, and the governor and others see it. Why not just take those steps?
Well, I think those steps are fine to take, but I think we're wasting money. And my read of the law might be a little different, but I think we can still apply for a state plan amendment. I don't think anything precludes us from going down the path of a waiver at the same time. Again, other states are doing it. And frankly, I'm a little worried about our phase 3 strategy because the Trump administration indicated they're not really supporting these hybrid waivers to continue Obamacare, which is a program that they don't support. So I'd rather just do it through the most clear means possible, the straightforward way that is provided for the Affordable Care Act, and do the state plan amendment, which would take a few months, get it done. Let's be on the path to getting people coverage, do it in the most cost-effective way, and also do the waivers. And if we say we do need to go to special session to make that happen, again, if the Legislative Council is saying something different, then I respect them. But I think that let's look into that.
Okay, I've got 30 seconds left. I'm going to let you have the final word. Address those 2 points. One being the cost, the 70% versus the 90%.
One thing we need to keep in mind is we've got 40,000 plus Utahns in the federal marketplace between 100 and 138% of poverty. Federal government's paying all of subsidies. Once we move them on Medicaid, we have to pay 10%. That's $35 million a year state share. So there's a cost there that people don't seem to be mentioning. Secondly, the plan amendment is going to require legislation. Our health department is not going to just submit a plan amendment. I met with our director. They don't do things like that absent legislation. And so we've already got legislation on the books, and that's what we're going to do.
All right. I'm going to have to end on that note. We could do the whole show on this. I probably should have thought of that. But I really appreciate your time, at least getting some more information out there as much as we can. Thanks so much for being here.
Thank you.